I think the reason why inequality produces stress is that in a more unequal society with bigger income differences between rich and poor, some people are regarded as supremely important and others are regarded as almost worthless. And it means that we all worry about how we are seen and judged. Class and status become more important. They affect how we judge each other. And as I say, they increase our fears about how we are judged. And so all those anxieties about whether people think you're clever or stupid, whether you look successful or a failure, all those things to do with self-presentation, social comparisons, become more intense. The solutions have to be political. And whether one's talking about physical or mental health, social and economic life dwarfs the importance of medical healthcare services. Much more important than the treatment you get for a disease is whether you get it in the first place. The big differences in death rates between higher and lower social classes are principally caused by differences in the lives people lead. I think it does what is really important, that we should be emphasizing the social and economic determinants of health. Many people think that populations are healthier now than they used to be, primarily because of medical care, but that's not true. We're healthier now than we used to be, primarily because of changes in social and economic life, rising living standards, things like that. In poorer countries, it's really important to have economic growth to raise material living standards. In both rich and poor countries, the amount of inequality, the differences between rich and poor, are really important influences on health. But in the rich world, economic growth is no longer related to changes in health. So really the most important thing I think we can do is reduce the income differences between rich and poor.